She has a special interest in ethics, anthropology, and sociology, and an interest in the medical world.
And last but not least, we have Dr. Zaid Ghani. Zaid Ghani is a first-year medical intern at Chris Hani Baragwanath Academic Hospital and an aspiring physician. He's passionate about medical education, pedagogy, and motivational psychology. He's taught physiology in a personal capacity for the last 4 years. Okay, so for the first section we're going to cover today, we're going to be asking you all about your journey into medicine. So firstly, what would you say inspired you guys to pursue a career in medicine in the first place? Anyone?
Sure. So I come from a family of doctors. My father was a GP, and I'm not sure if it was just kind of what you're used to and what you're exposed to. But yeah, I think my sister then went into medicine, and it seemed like a natural progression for me. And I'm not sure if doctors make other doctors or or yeah, look, and I've never regretted my decision, and it's been a wonderful journey for me.
Just to add on to that, so I actually come from a family of a very different side. I come from a family of corporate people, and I did not want anything corporate, not accounting, not finance. So I decided to steer away and be one of the first doctors in the family. And I also have no regrets in choosing my path. It's been one life-changing experience, and I'm really happy with my chosen path.
Yeah, I actually wanted to do public health. Like that was my main goal. And at the time that I was applying for degrees at university, we didn't have the Bachelor of Health System Sciences that we have now. So the standard route to get to public health would be to do a medical degree and then do a master's in public health. So that's what I did, and now I don't know if I will end up going into public health, but yeah, that's what inspired me, and I think like most people who are in medicine, it is kind of a natural progression. If if you're like have a certain personality, then you're either the eldest daughter in your family or the eldest son. It kind of just happens where people have that expectation of you and you just kind of go with it. But yeah, that was basically what inspired me.
I think I always had a keen interest in healthcare, always like it was something that was important to me, and that combined with my interest in like understanding how the human body works. I think I went into medicine more for the degree than the actual job, but I seem to be enjoying the job, so I'm grateful.
No, that's brilliant. Thank you all for that. Now, were there any moments across this journey that made you doubt your path? And if so, how did you guys overcome those challenges or those doubts?
I think like as a junior doctor who's just finished medicine, I think burnout is something that is rife in our medical degree, especially at BITS, where you sort of have this do or die system where you can become very synced in fifth and sixth year, having to cram a lot of theoretical knowledge in the first 4 years of the degree. I think for me, burnout was a real thing towards sort of the middle of fourth year, where you sort of just going through these 6 week, 7 week blocks over and over again, having to write those high stakes exams. I think it's important to firstly sort of be consistent and just do a little bit of work every day and sort of like allocate time in your day to resting and doing things that you like outside of medicine. And I think success in this field, it does not require constant engagement with it. I think it's more of a long game. So consistency and like scheduling breaks and things like that will definitely help. And as a junior doctor, like burnout in medicine, working as a doctor, I think that it's important that when you get time off and you get leave, to completely dissociate from it and sort of live your life and do the things that you enjoy that make you happy and that you remember that make you happy. And I think that really helps with
receive of an end to, that format of learning. And that's kind of when I felt a bit disillusioned. But yeah, there is obviously a lot of hope in that sense. Like once you enter into the clinical space, things become a lot better. Yeah.
I'd just like to say that the major turning point for me was actually when I transitioned from being a medical student to actually being first year intern or junior doctor day one. You kind of thrown into that world of you have to have almost like a expectation of where you're supposed to be and what is expected of you, and do you actually feel like you fit into those shoes? So it's a lot of doubting yourself initially, but you know that there's always someone there that you can always ask for help, which is amazing about the internship. But there's also certain aspects where you still feel like I'm growing, I'm changing, I've never done this before, and it really can just kick on you as well as your performance in that field, especially when you're tired and you're drained emotionally, physically. But you reap the rewards of seeing your patient actually get through something and get better, and that actually makes it worth it. So I feel like medicine is also ever changing, and not just from that transition of being a student to being an intern, but ever changing in your role as you grow as a person as well, from your internship to your concert, from your concert to medical officer and so forth until you specialize. I feel like it's always changing you and molding you to be a better person. So it's a different path, and it's not one for to take lightheartedly.
Sure. So I'm acutely aware that I'm by far the oldest person in this room. I'm probably double anyone's age. But when I think back to the decades ago when I was a junior doctor and a student, I think the two sticking points were first, second, and third year was fine because remember all your school colleagues are all still at varsity and you're all in the same kind of thing, slogging away at varsity, writing exams, and then your school colleagues finish varsity, they get a job and they start earning a salary and they start going to fancy bars and buying expensive drinks, and you still studying. So number one, you don't have the time to go and party with them, and number two, you're not earning like they are. So suddenly you're on a different kind of footing as your school colleagues. And there sometimes seems to be a drifting apart of you and your school friends. And then when you start in the clinical years, you're often quite tired from doing calls. So yeah, that was a bit of a sticking point. And then internship, you've spent your entire 12 years of school, your entire 6 years of medicine where your path is just laid out for you. You kind of know, or you just get told what you're going to do. And suddenly you get thrust in this job and you may or may not have great supervision. And the times when you don't have adequate supervision and the fear that you may have someone's life in your hands, or you make a mistake, which happens to all of us, it can be quite frightening. And yeah, you've got to grow up quite quickly, I think, in internship. It's not always easy, and medicine, you said whether you're enjoying it or not. I don't think medicine, I think a lot of the job satisfaction makes up for all of that.
Thank you so much. Now, I think we've touched on this briefly, but what would you all say was the most challenging part of medical school?
Huskies. 100% I think there's nothing worse than being like assessed out of I don't know 100 and something in 5 to 15 minutes, and that is the assessment of all that you like struggled to achieve in 6 weeks. I don't think that makes sense. But and it's definitely the most nerve-wracking part. But I think if you sort of put yourself in a space where you can practice in a way that your exam is going to be, so having mock OSCEs with your colleagues, with seniors that are nice to you, and I mean if you're in third or fourth year and you're doing your OSCEs at uni, just like every second day or every third day, it's like practicing with your teddy bear or something. really does make a difference. And I think that we at Wits, I think we are a bit compromised in terms of our clinical exposure. And I see this more now than ever as an intern and the number of patients that we see, and I think to what Franz alluded to, like having to step into those shoes in the clinical space, especially coming from a Wits background. I think that our clinical exposure isn't that great, and competence is also a big thing in the back of all of our minds. And I think that fear of being incompetent is the biggest challenge when it comes to like OSCEs. So definitely like practicing, practice, use your hands, actually do it, actually speak, and learn the language of medicine. That's a very important thing. That's what people are looking for to see your maturity. So I think
competent, that is progress. Part of OSCEs is talking, so, and exams, and when you start getting into a reg post and starting to do your specialist exams, so much of those exams is talking. And the sooner you learn to talk confidently to other healthcare professionals, the better. So don't be a shy wallflower. When you go into the hospitals, talk, ask questions, and also from a consulting point of view, if I have a medical student in theatre, I've got a job to do. So I'm going to go ahead and do all this stuff. And, if I have time, I will teach. And if somebody sits in the corner and reads a book, that's, it doesn't affect my job. But, and in fact, it makes my job easier because it's less work for me. So my advice to you is when you are in the hospitals, take an active role. Ask questions. Ask if you can do the lumbar puncture. Ask if you can do the drip. Because it's probably quicker for the intern to do it themselves than to teach a medical student how to do it. Correct? So they would actually just rather do it themselves because it's less fuss. So don't be a shy wallflower. Be active and ask. Ask lots of questions and ask to do procedures because you will gain so much more from your clinical exposure that way.
Yes, thank you all for your insights. Now, another topic we touched on pretty frequently is the idea of mentorship. So, how important was mentorship and these various support systems to you all throughout your medical journey?
Sure. Should I start? So when I did medicine, there was no such thing as mentorship. That just didn't exist. But being a mentor myself to new registrars, I think the important thing is finding somebody you can relate to. So they've done studies in mentorship where if the mentee chooses their own mentor, that was
that's a nice way to wrap out our journey into medicine. I think now we can move on to career mythbusters, and I'll be handing over to Samsa for that.
Okay, so we do have a QR code for everyone to scan and they can actually take part in this session. Okay, so we have 3 questions, and we're gonna ask our speakers to either debunk these or clarify some misconceptions. So first one, you have to know your specialty by the time you finish medical school. Reality or myth?
I hope not. I don't think I know mine, so based on reassurance,
So reality or myth? So you can either debunk it or clarify some misconceptions.
I don't think you need to know. So I do think it is myth. But I do think by the time you finish medicine, you have some sort of idea of whether you a surgeon type or physician type or a lab type of person. I think you will have some idea about that. You know, there's some people who are just good with their hands and others that are not. There are others that don't enjoy people interaction and would be happier looking down a microscope and not having patient interaction. So I think by the time you finish medicine, you have got an idea about that, but I certainly don't think you need to know if you want to specialize in what you want to specialize in. I don't know if you will agree with me.
I think I would just maybe add on, I would rather do internship and then try and figure out what I enjoy the most. For me, I actually changed my mind a lot. So I initially thought I wanted to do surgery, and then I started my first year of internship, ended rotational surgery, and I hated it. And yeah, then towards the end of the year and my second year, I got exposed to anesthetics again, and then I actually found that this is my passion and I enjoy physiology, pharmacology, the different aspects of it. So I feel like it's an ever-changing decision, if I may say. So I feel like you're allowed to change your mind, and go with the flow. Make yourself happy, as long as you're happy.
I think I'm going to use an example here. The other day, I was talking to Zara, and I think that she was born to be a physician. She's absolutely brilliant. She did her first rotation internship in medicine and was recognized by probably every consultant that she interacted with as brilliant in the field, right? And whenever I speak to her about it, she says that she's going to do surgery later. And I get so confused, and I say, she says, just wait until you do like surgery as an intern, like you're gonna hate it. And then she said something profound. She said that how can you judge a discipline that you've just spent like maybe like 12 weeks as a student and 3 months as an intern in as a career path for the rest of your life. And if you think about it realistically, like even if you choose a specialty, there's so many sub-disciplines that you can go into. There's such niche disciplines that you can go into in your field. And I definitely don't think that is something that you need to know as a student. Definitely not. Of course, you should take a keen interest in something, but it doesn't have to be the be all and end all. And if you sort of like have your heart set on something as a medical student or as an intern or as a medical officer working in that department, it's never too late to jump ship basically. I think that you sort of have unless obviously it was a chaotic night and there were like many unseen patients. If there's just one or two things to do, then you would take breaks. So I think it's important to, in order to get sleep, you have to sort of like look out for yourself, and it's going to be amongst your colleagues. So like our seniors wouldn't care whether we would sleep or awake, and wouldn't care if we rested or not. So it's something that you have to sort of like be active in, to be able to get sleep.
But I must say that a lot of the hospitals don't have clean, safe spaces for us to sleep, especially Barra. So when you do sleep, it's often in your car, which is hard and freezing cold. So that's something that we need to work on, and it speaks to how little our rest is actually prioritized. I started my internship in internal medicine, where after doing a full night of work, with no sleep throughout the night, I would only leave the next day at 4 or 5 p.m. because there was no system where anyone could cover us after a call. We had to finish the work that was there, you know. So there's a lot of variability, as I said, with the departments and how much of rest you do get. But and obviously a lot of variability between hospitals. So when you do choose your internship, I think it's actually something you should look into, like how do the core systems work in that hospital, and how conducive do those core systems make it to get some rest in between. But yeah, I think we can move on to
Yeah, I think it's an absolute reality as a junior doctor, and even as a consultant when I was working in Dubai, I still had to do night calls. So if you are doing clinical medicine, you will have to do calls and you will go through nights. There's no getting around it where you're not going to sleep. So yeah, you just have to make sure that the days that you can sleep, you sleep well, have good sleep hygiene. I worry inordinately about doctors driving home after 30 hours of being awake. And I think maybe then it might be a good idea to rather catch an Uber, because falling asleep at the wheel is an absolute reality, especially if you going home at peak hour traffic and you're in bumper to bumper traffic. It's somehow easier to drive when you're going fast. But I remember the day after call, like opening windows, putting the music on so that I wouldn't fall asleep at the wheel. And then being so wired when I got home that I found it difficult to fall asleep. I don't know if you think all you want is your bed, and you climb into bed, but you are so wired from what happened during the night and on your call that it's quite hard to wind yourself down to fall asleep. And the other thing is nutrition. I used to eat absolute rubbish to keep myself awake. I would eat chocolates, and drink Coke, and so I think it's important to try and pay attention to good nutrition. And it's again hard, like at Barra it's inordinately hard, there's nowhere to buy stuff. But if you've got a lovely mom who can give you a home cooked meal that you can just on your nights or your days post call, because the last thing you feel like doing is cooking a warm, hearty meal. Even if it's just going by, treat yourself to a Woolies meal that you can just warm up in the microwave and have something fairly nutritious to eat before you go to sleep. But unfortunately, being a doctor, and if you're a clinical doctor, you will have sleepless nights. There's no going around it, no getting around it. And yeah.
And just to add, be prepared to hear monitors beeping in your sleep after every call.
I was told to.
Our next question will be, being a doctor means
session, we're going to be talking about the realities of being a doctor. Given that we've got a wide variety of experience on the panel, it'll be very interesting to see what a day in the life looks like for you guys. So that's our first question. What does a day in the life in your role look like?
Starting with consultant.
Cool. So, wake up at 4:45. Go for a run. For an hour. Breakfast. And in the car to Barra. So, normally get there by 7:30. Check that everything's in order, that there's electricity running water, that we have staff, yeah, and then I generally supervise registrars, do some teaching, and I'm quite energized by having all these younger people in theatre who can teach me so much, and yeah, and then I am now at the stage of my life where I don't do nights, I don't do weekends, I do public holidays. I am 54 though, so so you eventually do get there. Yeah, so that's my life.
So I have many different things that I do. I work 3 jobs, so it depends on what I'm doing on which day. So many of my days look different throughout the week, but I try to keep a roster for myself, or rather a schedule for myself, because as a sessional, you're kind of making your own routine. So I try to keep it structured. So Mondays are my relatively short days. I locum for a GP practice. I'm on a recurring locum as well. So if I'm not at Barra or I'm not at Lips, I'm at the locum practice. And that's generally an 8 to 4 day, or sometimes a 10 a.m. to 2 p.m. day, just depends on which facility I'm at. If I'm on shift at Barra, if I'm on a day shift, my day starts quite early. I usually wake up by 6 because I just want to sleep until past it. Because I know if I'm on the floor, I'm on the floor. But I would say at Barra usually by around 4 to 8. And the round starts at 8. I'm in casualty. So, you have to be there on the dot. No excuses. Can't be late. They actually name check if you are. So rather be there early than be late, get there on time, and my shift will end at 9 p.m. at night. And then you have the long drive back home, I'm tired and exhausted, but I'm grateful to sleep in my bed. Unless I'm on a night shift, like last night. So then we usually start, sometimes throughout the day, I either do my GP locum, or if I'm at Vips, then I'm here, usually I come in the morning. So I think I only interact with the Game 1 students from the 8 a.m. to 11 a.m. slot. And then I go to my GP locum for the rest of the afternoon, and off to my night shift at 7:30.
Sure.
Yeah, and then work the night and enjoy my day off. Usually when I'm post night, I'm off on my day, and I work 1 weekend a month. That's just part of my contract. So Friday, Saturday, Sunday. And if I don't feel like working a public holiday now, I feel like I've been upgraded. But just because I'm sessional, I don't always have to work a public holiday in the department that I currently am. So that's quite a nice thing. If I feel like I want to be off on my birthday or public holiday, that's really important for my mental health. So I'm enjoying it, and I take it with open arms.
I think Zaid can answer the both of us because we are the same.
So yeah, I think I'm in a good rotation to tell you what my day is like. So at Bella at 5:30, start pre-rounding on patients. This is internal medicine specifically. Check the scans, write the blood forms, at least there's splits in internal medicine, which is very nice. Check on all the patients, examine them, check if anything has changed, and then round with the registrar, and then basically do whatever work needs to be done. No morning round, by the way. Do whatever needs to be done, but this is something that I enjoy. I like to get to work early. I like the feeling of having the bulk of the work done before midday, and then just tying ends after midday. And in internal medicine at Bala especially, because the patients belong to you, not to the registrar. So it depends on your patient load what your days look like. So if you have 30 patients, you're going to be there for a very long day. But
most difficult as well as one of the most rewarding parts of your career?
Sure, I can easily say the most rewarding. So because I have an interest in regional anesthesia, which is doing nerve blocks and reducing pain intra and post operatively, I get such a kick out of waking a patient up who's had a broken arm, broken pelvis, broken legs, and they've been on the table for 10 hours having all their bones fixed,
and you wish you did, and then you feel like really sad about yourself because you know that you're not doing enough to advocate for your patients. So that's the type of thing that really does get you down. and and I think that being aware of it helps. You need to every day ask yourself if something's happening in front of you, like is this is this something I can change? And can I just give myself the extra oomph to fight just a little bit more today? But yeah, on the positive side though, I think something rewarding about being in the medical space that I didn't get to see at all as a student was actually feeling like a participant um, in the team. Because when you're a student, you're kind of feels like you're a burden to everybody. And when you're in a ward round, you're at the back of the ward round, just trying to listen to someone's assessment and trying to get just a crumb of knowledge from the ward round. But when you're like an intern or a reg or a consultant, like as an intern, I'm doing a ward round on patients that I personally admitted the whole night. I've spent the whole night working, admitting these patients that we are running on. So I go in with the mentality like this is my ward round. This is not about anyone. I'm going to be managing these patients and I get to give my insight and my opinions and they are received with like well, like because you're a member of the team, because you're going to be responsible. It's a whole different perspective, and that is very, very, very rewarding, and that makes you feel like you have a lot of purpose in what you're doing. So that's something to look forward to when you start working. Yeah.
I think one thing all of you will realize in internship is that you're not just a medical officer intern. You are the porter, you are the nurse, you are basically doing everyone's job. You're doing literally everyone's job. And that's because I think it's a certain type of person who does medicine, someone who is willing to advocate, someone who cares, someone who has a heart for community. And you will end up going above and beyond to get patients what they need. And I think more than anything, or more than anyone in the hospital, it's you who's going to know what the patient needs. If the patient needs an ultrasound to get their diagnosis or needs urgent blood results, you're going to walk up to the lab personally and mark the bloods as urgent and get the bloods done, and you're going to sit there and wait there for the results. You're going to port patients to CT because you know that if you don't do it, the port is not going to take the patient. You're going to really, really go above and beyond, and that can become really exhausting, especially with what was alluded to before, like the resource constraints, like just basic things, trying to put a drip in. Like you would expect a medical ward to have enough IV cannulas, enough strapping to put in a basic drip, and that's not present in the ward. If you want to do a lumbar puncture, and bear in mind, if you have 30 patients and you have to do a lumbar puncture, you have to get a lumbar puncture needle or a spinal needle from the sisters. And how long do you think that takes when you have 29 other patients to see? So that type of thing definitely poses a challenge. And you sort of like, part of being an intern is learning to be resourceful and learning how to do everyone else's job on top of your own. And it's not just something that you're going to do that is going to be rewarding for you, it's going to be expected of you, which also becomes burdensome. I think for me, what keeps me going is definitely patient outcomes. When a patient comes in like extremely, in respiratory distress, has a risk rate of like 60, becoming delirious, retaining oxygen, and then you see them the next day and all of a sudden they're a whole different person. I think it also makes you aware that people you see on your intake or on call, that's not who they are. Your first encounter with a person is definitely not who that person is, and you may find yourself becoming frustrated if the patient's not cooperative or things like that, and then you sort of realize that this is a patient in their sickest form, and when you see them in their healthy form, I think we have this in sociology, sort of like this disembodiment, re-embodiment phenomenon. When you get to see them in their re-embodied state, it's I think that's the most rewarding part in actually learning who they are as a person.
we move into speaker-specific questions, as well as before we open it to the floor, we have noticed that there's been a recurring theme of moral injuries. So our next question to the panel would be, how do you handle the emotional stress and burnout, especially from the emotional strain you undergo when you have to deal with moral injury? How do you keep your emotional composure and keep yourself stable during all of this?
So I think talking and sharing the burden with colleagues who understand what you're talking about. If I have a tough time, in fact today we had a little kiddie with a VSD needing a tonsillectomy with pomponanane, and the kid did really badly under anesthesia and had to
Thank you so much to all our speakers here today. So in light of time, we're going to skip directly to the Q&A session. So if any of you guys have questions, feel free to ask our panelists.
I have a question. You mentioned that you're now at a stage in your life that you have control over your time. In a sense, you don't have to work shifts and things. What age did that change?
Gosh. So, after people
much for your time. We are really honored to see such a good turnout. Thank you so much to the doctors that chose to join us on the panel today. We are really, really grateful for your insights. Thank you so much for being willing to share with the students. Thank you so much for accommodating us. We really appreciate everything.